You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. I'm back today to talk about vitamin B12, one of my absolute favorite vitamins, part 2. And in this talk, I would like to describe what you can use B12 for therapeutically, not just for basic nutrition or to help make red blood cells and the everyday tasks that your body performs. So B12 really is important in nerve health. I cannot emphasize how important this is. So if you are deficient in B12, you might have neuropathies, which are nerve pains or nerve damage. You can actually use B12 to treat neuropathies from whatever cause there is. Let me give you some examples on that. Let's say that you have sciatica. This is an inflammation of a big nerve that comes down the back of your hip and the back of your thigh. This is a super common problem for people to have, and B12 works beautifully for this. Now, therapeutic B12, when I talk about that, I am talking about injections. So a lot of you will say, oh my goodness, I can't do an injection. That would be horrible. Well, I have good news for you. B12 injections don't cause pain. They do not hurt. So I always encourage patients, let's say that on my prior talk, I had described how common it is to have low stomach acid. And as you get older, digestive efficiency decreases. A lot of times older folks need B12 and have a tough time getting it in for just good health. So I really encourage my patients to learn how to self-administer if they want to nourish themselves with B12, or if they want to treat things. They really need injections. Now, a little word of warning. Most regular doctors do not know about therapeutic uses of nutrition. Not very much, anyway. And when you tell them, I'm taking injections of B12, it causes severe freak out syndrome. This is a water-soluble substance. It's a natural substance. You can overdo it. You probably should take some oral folic acid if you use an excessive amount for a long time. But please do not get a B12 serum level, because if you are injecting it, say that you're injecting it twice a week, your serum level will be high. I can guarantee it. However, it is water soluble. It will be taken out of the body. Don't worry about it. If you were using a drug, you wouldn't worry, oh my goodness, this aspirin level. Well, maybe you would, but when you're looking at something therapeutically, you might have to use a higher dose for a while to do the job. So let me talk to you about some of the things that this helps with. So we've discussed neuritis and neuropathies, such as sciatica, and anything like, especially diabetics tend to damage their nerves and have they can't feel their foot very well because of the nerve damage. Alcoholics tend to have nerve damage in the extremities as well. You also might want to use this for Bell's palsy. This is the damage of some of the facial nerves from an infection. If you've had shingles and you're trying to recover and it hurts, the reason it hurts is because a virus has damaged nerves. This can help with recovery. It can help decrease the pain. For all the golfers out there, you can get an inflammation in your subdeltoid bursa, which is in your shoulder for those people that speak English. For those regular folks, this is shoulder pain from excessive use. It's the sac that makes the motion of your shoulder smooth gets inflamed, swollen, and painful. The B12 can fix this. A couple of shots a week will probably do it. You might want to do 3. It depends on how bad it is. But you can also have any joint pain can be pain. If it's inflamed, B12 can help. What else could you use B12 for? Well, here's some thoughts. Do you have those terrible leg cramps at night? They're just very irritating. B12 can help with that. This tends to occur in older folks. And isn't it nice to have a non-toxic vitamin to help with these type of problems that are otherwise not much fun to deal with? I want to also mention that if you have an autoimmune disorder, this is where you are producing antibodies against tissues in your own body. By the way, people who have autoimmune disorders frequently, and I would say almost always, have low stomach acid. This is really important because it's very common for autoimmune folks to produce antibodies to the cells in their stomach that produce stomach acid. They kill them. So if they're killing off cells that produce stomach acid, you'll have low stomach acid, poor digestion, larger protein molecules going down the gut, which can be cued in by your immune system as a big foreign invading creature and cause inflammation. So there's quite an intersection with stomach acid and the ability to absorb B12. And that's why injections are so important. During the COVID outbreak, we still have COVID, but when COVID was first started to appear in this country, I did a video on how to self-administer injections of B12 because people needed it and we weren't going into the office like we had before. So there was not availability to go in the office and get an injection. So I always try to encourage people to do it at home. And I looked at a few videos and I thought, oh, wow, I've got to do more than this. One of them was a woman trying to teach people how to give B12 injections while she was at her farm in the outside. I think she was actually sitting next to a pile of manure. I mean, you want to be have some sterile technique when you're injecting something. So anyways, if you don't know how to do injections, you can check out my video. It's still up there. And I try to answer every question you could possibly have about doing injections. So that is the end of my talk about B12. And I will be discussing other very fascinating supplements. So stay tuned and thanks for listening.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.